Good morning, everyone, and welcome to QI Power Hour. My name is Tanya Verrill, and I'm a program director here at the Health Quality Council. For those of you who are joining us for the first time, QI Power Hour is a free monthly webinar learning series hosted by Health Quality Council here in Saskatchewan. We bring together improvers from a variety of sectors with an interest in improving health and to learn about quality improvement related topics. I'm joining you today from HQC's offices in Saskatoon, located on Treaty 6 territory in the homeland of the Métis. We recognize our obligations and responsibilities as treaty people to work with Indigenous nations towards reconciliation and health equity. I encourage you to reflect and share, perhaps via the chat today, the Indigenous land that you are joining us from. And also, I'd just like to acknowledge currently the challenges that are going on with regards to forest fires and ask you to hold in your thoughts those communities being affected by that. We want to let you know that all of our sessions are recorded, including this one today, and they are available on our website after the event. So please do go and check out the website and check out past sessions as well, and share those links with your colleagues. It's always great to pass along some of the learning. And while you're on the website, you can, we would invite you to sign up for our distribution list, and that's to ensure you receive regular invites and updates on upcoming QI Power Hour sessions. We are very excited to see the continued growth of QI Power Hour across our home province of Saskatchewan, but also across Canada and even abroad. So we just want to take a moment to thank you for spending an hour of your time with us and for your commitment to the ongoing learning to improve the systems that each of you are a part of. Just a reminder, we are in an audio broadcast mode, so everyone is muted. However, we really do want you to share and engage with us today with your questions, comments, and thoughts about what you're learning about today. And just as a reminder, for those of you using the webinar function or the WebEx function, the chat function, you click the message bubble towards the bottom of your screen, and that's going to launch that chat panel. And you can share your questions throughout the presentation, send your messages to everyone so we can all be part of the conversation. And we'll make sure we have some time dedicated at the end for some Q&As. So with that, I'm going to move into today's topic. I'm very, very pleased to have provincial colleagues join us from 3sHealth. So Janice Reeves, Jennifer Fetch, and Jill Forrester, as well as Lindsay Sanderson, a patient partner, are going to share their knowledge and experience embedding a customer focus in your work. So take it away.
Good morning. It's Jill Forrester here. I'm with 3sHealth. Oh, I have to learn how to move the slides. Just hold on. All right. So I'm the Continuous Improvement Director with 3sHealth, and the three S's in 3sHealth stand for Shared Services Saskatchewan. So we're an organization devoted to supporting healthcare in Saskatchewan, and I'll explain a little bit more about that. We're really honored to be here today. And all right, so there we are. Our tagline is Better Together, and we'll explain a little bit about how we work towards that. So today's session is all about embedding a customer focus, and 3sHealth has been on a journey, just like all of Saskatchewan's healthcare partners, in embedding quality improvement methods and trying to do a better job of listening to our customers. So I'm the Director of Continuous Improvement at 3sHealth. I've been in the role for 10 years, and I have to say that those moments when we hear with real clarity what our customer needs are, and it makes a change to how we think and how we plan our work, I would say that's the most satisfying part of my job, and I'm really honored to be here to just share a few things that we've learned at 3sHealth and hope that they might be useful. So I'll pass it over to my colleagues to introduce themselves. Jennifer.
Good morning. My name is Jennifer Fetch, and I'm the Director of the Provincial Linen Services team here at 3sHealth. So I manage the linen contract with between the health system's linen provider, which is KBRO, and the health authority. So my background is in continuous improvement. When I began my career in healthcare, I actually joined Jill's continuous improvement team, and that's where I started building my lean tool belt. I then had the opportunity to take everything I was learning and apply it directly to the linen service line back in 2015. That's when the contract with KBRO began. So the opportunities with linen in healthcare really, really excite me. I just think you can do so much with linen that most people don't often think about. You can change the way that a patient receives care. You can change the way that a frontline employee does their job. And you can even create savings to someone's time or their budget by making improvements to how the linen's being used. So I'm thrilled to be here today presenting alongside Jill and Janice and just talking about how continuous improvement has just shaped the way that our department gets to make and sustain changes. So thank you for having me. Over to you, Janice.
Hi, good morning, everyone. I'm Janice Reeves, and I'm the 3sHealth Patient and Family Centered Care Lead here at 3sHealth. And I believe that as leaders, we need to advance a just cause. And mine is to inspire people to overcome adversity with integrity so that we can live in a kind and compassionate world. And I've put that purpose to work and helped to bring out the customer voice in a variety of industries and roles over the last 18 or so years, including justice, that includes corrections, public safety attorney general, tourism, culture, sport industries, healthcare, both in Saskatchewan and across Canada, as well as in some Canadian private business. So I continue to work that purpose with 3sHealth. I'm very excited about the things that we're doing here. And in this role, it's my job to ensure that patient voice is front and center in service lines as we work towards a healthy population. Thank you.
I think that's me now. Hi, I'm Lindsay. I am a patient family partner, or PFP, as it'll probably get referred to within this presentation, with both 3S Health and the Saskatchewan Health Authority. I really believe that we all have a role to play in co-creating the organizations and communities that we want. And that's why I took on the role of becoming a patient family partner. In my various experiences with our healthcare system, I have seen the need for the patient voice to be a part of that conversation. So my goal as a PFP is to ask questions, shift mindsets, provide context, and ensure that patients are always a part of that conversation. And I think, Janice, you're going to take it away next.
It'll be back to me. Right on. Thank you. Okay. So what have we got for you today? So we've got a bit of a 4-course meal for you that we hope all the pieces go together quite nicely. So first, we're just going to learn a little bit about 3S Health and how we connect to patients, families, and providers. Then Janice Reeves is going to teach us a little foolproof method to reframe how we think about defining problems when we're doing improvements. And we'll get to try a little exercise there. Third, we're going to talk about how we also not only define the problem from a patient perspective, but how 3S Health has been measuring lives positively impacted. And then finally, we're going to hear how Linen Services has pulled all these pieces together with an awesome story. So that's what we're going to take you through today. Next. Okay, so as I said, 3S Health is Shared Services Saskatchewan. So what drives us? Our vision is healthy people, healthy communities, and healthy partnerships. So you see right in our vision statement, we know that we're connected to frontline care and making people healthier. And you see right in the center here, the photo with the patient, the mother and the child. There's a target embedded there that we want to pause by 2025, we will positively impact 1.2 million lives. So we're going to talk a little bit more about that. So you can see that we're striving to make that connection. Our mission is partnering to solve complex problems and improve healthcare across Saskatchewan. So I'll just explain a little bit more about that. We have 6 provincial service lines that we provide to help the health system improve and help deliver critical services that are needed. So each of these services were all once a complex. Is there supposed to be a slideshow? Yes. So apparently people can't see the slides.
Yeah, we can address that. Keep going. Yeah.
Okay. Okay. I didn't know if I needed to share. Okay. So each of these services were once a complex problem that needed solving. So for example, back in prior to the 1970s, all healthcare workers across the province were parts of different separate benefit plans. And then 3sHealth and prior to 3sHealth, SAHO worked to create some provincial benefit plans. Provincial contracting has origins dating back to 1918. The first ever meeting of doctors in the province. They said, is there a way that we can do group purchasing together so that we're buying similar goods and services and getting better prices? So provincial contracting is a service that grew out of cooperation, and it was a complex problem that now we're solving. So just an example of where all these services come from. And today, we're very proud that our linen team is going to be sharing a story with us. So 3sHealth is also, we are only one of many health system partners that work together to deliver care. And everything we do is in support of the success of our partners. We also have been working hard to develop a patient family centered care program. So we have awesome patient family partners that help us hear that customer perspective. So we've matched our patient family partners with our service lines and some projects that we work on. And we're just excited that they are bringing that new perspective to us every day. So what we want to share today is some things we've done to help us open ourselves to hearing that customer voice in everything we do. So Janice Reeves is going to take over this part. What she's going to do is talk about one of the things we do, and I think we've all experienced it when you're trying to understand a problem. You've got a problem you want to solve, and everyone in the room tends to be the workers doing the work, and we know what we're seeing and hearing, and we're working on solutions. And it takes a little extra effort to think beyond our own perceptions and understand what the customer is experiencing. So Janice Reeves joined 3sHealth last year and brought with her a really cool method and some teaching that has really helped us out. So over to you, Janice.
Thanks, Jill. Okay, let's try to take the presenter role. All right. Okay, so let's talk problems. So the first step to getting all this stuff rolling, I guess I need to figure out how to see my notes here. Give me one moment. I don't see my notes. All right. Well, I'm gonna try to do this without my notes. Okay. So the first step to getting all this rolling is that we need to be able to recognize the difference between business problems and customer problems. And it seems really simple, but a lot of the time, as Jill mentioned, it's not always that simple. So we need to be able to do this because as lean practitioners, or we need to be able to help our business partners get what they want. So help their business problems or experience, but we also need to give them what they need. So, which is the customer problem or experience. So we need both. And the role of the business is to provide value to others outside of their company, right? To help solve problems, because without it, we don't have a business, right? And we can't help our partners or our suppliers deliver that service. So I don't know about you, but I've experienced some pretty strong resistance around bringing that customer perspective to the table and creating that shared understanding between business partners and customers. So let's kind of dig in to what that might look like and see if maybe you can relate here. So here's how it would go sometimes, or most times. A business partner, like we would go through a consultation, our initial consultation, and business partners would approach me for help with, their process problems, and we would meet to explore it. And I would say, what seems to be the problem? Or what's your customer experiencing? And they would respond with something like this: need to fix our database. And so I would say, well, a database isn't a customer problem. So what is your customer experiencing as a result of not having that thing? And those are tough conversations sometimes. If my business partner was bent on only looking at their problem, so we would hit a wall. And I would end up asking for the data, just give me all the data related to the business problem that they were having. And I would get in these sort of data points in the form of maybe project charters, or have multiple meetings to discuss it, or a multi-page business case. And the result of that is that, it was pretty tedious and overwhelming. And the information or the data actually, would list like a list of complaints or emails or notes from a ticketing system, perhaps something similar. And most of that information was incomplete or didn't capture the right sort of feedback, or business partners were afraid of asking their customers directly. So in the end, the information was partially dismissed. So much for knowing our customers, right? So this went on for years and it became really frustrating. I almost gave up because at the time, I believed that the resistance was a mindset problem that couldn't be shifted in weeks or months. We just didn't have the time. But that belief was changed over COVID, where I visited another health authority outside of Saskatchewan to help with some just current state analysis. That senior team only knew a little bit of lean, and I only had 5 weeks. And so I was on site for 5 weeks in both a hospital, like a clinical setting, and a business setting. And I tried teaching them waste. I tried teaching them the lean management system, and they just didn't get it. It was just too complicated. So we hit a wall again. And I remember being so frustrated and feeling so under pressure to deliver something in 5 weeks. I sat in front of my computer. It was like a blank screen. I was like just racking my brain to figure out, how could my 10-year-old daughter do this? And I think it was midnight and it hit me. I'm like, oh, it's got to be a fill in the blank. It's got to be that easy. And so I thought, well, we'll give it a shot. And the great news is because I thought I was going to actually offend some people. This is how simple it is. But it didn't. And I tested it. We did it. And after stepping them through a tiny bit of analysis, we were able to fill in their first strategic customer problem statement. And the team felt like for the first time, they made some headway, and they can now comfortably take that information and go speak with customers. So it was a win-win. It was very exciting for me, personally fulfilling for sure. And it just goes to show that truly with any problem, there is an opportunity. And so I hope what we offer today helps ease some feelings of maybe some discouragement or frustration, or feelings of maybe overwhelm possibly. And even if you think you've got all this nailed, maybe you do. This approach will actually, that you're going to learn right away here, will help you clarify customer problems and opportunities even further and faster. So let's get into it. So first, we need to maybe frame up what customer-centered business is. So here's a little definition. Businesses that place customers at the center of all business decisions and focus on understanding and meeting the needs, wants, and preferences of customers in order to create a positive experience. So business definitions are great, but what is the thing that helps us ground ourselves in customer centeredness? And we need to think about our own experiences of being a customer. That's kind of where I come from. So with that, I'd like you to think of a time. Now, I like a little bit of engagement here, so if you're able to use the chat, I would really appreciate if you played along. Think of a time when you received poor customer service. Sorry, I've got planning down there. I'm not sure what happened. So if you think, I'll just give you a minute to think about the last time you had a really terrible customer experience. See if maybe, I don't know, Tanya, could you maybe keep an eye on the chat there for me? I don't have a lot of room.
Absolutely. Yeah.
Thank you so much.
Yeah.
So as you're thinking about this experience, I want you to go a little further from what tasks you were trying to accomplish to how did it actually make you feel in the end? And that's what I'd like to see in the chat. How did that make you feel?
So we have some folks sharing a little bit about experience trying to book a hotel room, and I shared my feelings around an experience I had as frustrated.
Yeah.
Heather,
Frustrated.
yep, angry, invisible, undervalued,
Oh, yeah.
ignored, disrespected. Oh, WestJet, sorry. I think for
Yeah.
air travel, yeah, dismissed, very annoyed, minimized. Yeah.
Oh, yeah.
Yeah.
Yeah, great. Thanks for playing along. Let's keep going. So I heard a lot, right? Yeah, we feel angry, frustrated, lots of things, afraid, rejected, dismissed, lots of those, right? So the concept here that I'd like to sort of just introduce is that we can feel all these things, and so do other people. And so we feel these things. When we feel these things, those make memories. So emotions make our experiences memorable. And this concept is that a memory will only be created if the experience had an impact. Okay? Memory will only be created if experience had an impact. So having a positive impact or experience means that you've gotten what you wanted and needed out of the exchange. That means your problem was solved. So how much of your problem was solved can be actually seen in the way businesses set them, or service lines, you can think about this, set them up to help you with your problem. So we're just going to pull back the curtain a little bit on the approaches of how business-centered companies and customer-centered companies are set up for you to feel either that you had a good experience or a negative one, like where the business missed the mark. Now, I just kind of want to reiterate, when I say business-centered planning, please think of this as, you're providing a service or you're helping your business partner or your supplier provide their service. So here's an example of a business-centered plan. So business-centered planning, it's, it's a classic, right? We start with an asset. We start with a core competency. So this typically is an idea or human resources, your assets, your business assets, or your service line assets. And then you'll do a whole bunch of stuff in the middle to try to build your idea and then eventually bring it to the customer. This approach is a classic solution in search of a problem. And the risk is that we're building a solution that nobody asked for, or we completely miss the mark somehow. Now, here's customer-centered planning. In this model, we start with the customer, right? Need a problem at the beginning, because that's where the greater likelihood that we won't miss the mark by much. And we're creating solutions that people really want and need while providing a positive experience. So when we're presented with a problem or opportunity, the question here is, what lens are we using? A business-centered lens or a customer-centered one? And what does that look like in terms of a written problem statement? So here is an example. These are example problem statements. We've got business-centered problems and customer-centered ones. So these statements, as a bit of a note, would typically be sent to you, right? Or be co-written. And you'll get these from business cases, like I said before, project charters, discussions. And one easy way to immediately recognize if a problem statement is business focused or not, it starts with the business. And the customer focused business starts with the customer. So let's look just a little tiny bit deeper here. But first, let's just walk through some of these. So we've got the first one is Blockbuster. Blockbuster is trying to acquire and sell movies in their stores, but business locations underutilize or overutilize human resources, resulting in high and sustainable operating costs. So we're talking about Blockbuster. That's what we started with. That's the model they're using. So if we were to flip this into a customer-centered statement, starting with the customer, movie lovers are trying to visit stores to rent and enjoy movies, but stores are inconvenient, resulting in searching for and purchasing movies somewhere else, which makes them feel irritated, frustrated, and discouraged. So slightly different here, right? Same with Harvard University. Harvard University is trying to maintain information on a bulletin board and newsletter using Web 2.0. You guys, I don't know who remembers 2.0, but information is out of date, resulting in low viewing rates. But if you ask the student, they're trying to digitally interact with other students who share common interests, but they're unable to locate them, resulting in poor social connections, which makes them feel isolated, overwhelmed, and depressed. So these two statements are actually, I'll tell you, they're actually from two industry leading companies, and see if you might be able to guess which one they are. But if we take a look at, just to pull some things to your eye here, if we use the business-centered statement to make improvements, Blockbuster, we might focus on the wrong thing. So we've got, they're concerned about human resources instead of stores. Or the Harvard University is focused on information instead of interacting and locating other students. So can we see how the business-centered statement that could throw us off of the customer problem? We want to learn to listen for these things through the customer lens as well. So fun fact, anybody guess which industry leading companies these two are?
Just add it to the chat if someone wants to
Yeah.
guess.
Blockbuster, movie lovers, Harvard University, and students.
Yes. Oh, Facebook and Netflix was something.
Right on. Good. Yes, that is absolutely right. They capitalized. They did such a great job at looking at the customer problem. They really, took that to the next level. All right. So what we'll do now is we're going to learn how to build these statements. So now that we understand why we want to use emotional intelligence and the customer lens in our work to better deliver exceptional services or experiences, we're able to recognize the difference between business-centered and customer-centered. We can learn the 5 key questions, those 5 powerful questions to help you interpret and document those statements fast. Now, I've done this in one consultation, not in weeks or months or years, so that you're well positioned to make the right improvements that are actually understandable to everyone. So we're going to hop into that right now. 5 key questions. Okay. The first question, define the type of customer. I am. I call these I am statements. Define the type of customer is the first step. 2, what are they trying to do? Determine what they're trying to actually accomplish. the third question. But what's getting in their way? The fourth question, what is that resulting in? What does that barrier result in? And the last one is, which makes me feel. How does that make the customer feel? You got to zone in on something that I call, it's a feelings wheel. I don't know if anybody has used or familiar with the feelings wheel, but it is a powerful addition to the 5 key questions, because we want to make sure, because remember, experiences are only memorable if they have an impact. So this is used in human services, and it simply offers an expanded vocabulary to help label emotions so that people feel heard and validated. So that you understand what they're feeling. So as soon as you understand how someone feels about an experience, you can immediately reframe it by using this. Make the connection, establish the relationship, and build that shared understanding. Okay. So with this, here's a little example that I've plugged into the 5 key questions using the movie lover example from earlier. So here, type of customer. I am a movie lover. What are they trying to do? Visit movie stores to rent and enjoy movies. But what's getting in their way? The stores are inconvenient, resulting in searching for and purchasing their own movies, which makes them feel irritated, frustrated, and discouraged. Okay, so you have a handout, I believe. So we're going to do a little activity real quick, 4 minutes.
Yeah, it's dropped in the chat. There's a link there to the handout.
Perfect. Thank you so much. All right, so when you open that up, take about 4 minutes, and by using that poor customer experience that we talked about at the beginning of this piece, thinking about that experience, are you able to write your own problem statement using your handout? So I'll give you about 4 minutes to try that out.
So Janice, do you want people to kind of share some reflections in the chat then? Because it'll...
That would be wonderful. Yeah, if people want to share, perfect.
Okay. Maybe an example of a problem statement that you're working on. So maybe
problem
if
statement.
people don't have one, or a customer they're thinking of, if they don't have one themselves, maybe they can learn from some other examples. That would be helpful.
Sure. Yeah. Okay, good.
So we haven't got anything in the chat yet, but maybe if someone's brave and they want to perhaps just share a little insight from what they're thinking about, having just been learning a little bit about this approach.
Yeah. And I don't want to put my patient family partner on the spot, but if Lindsay, if you've got one that you want to share, hop in, please feel free.
Yeah, sure. I
Perfect.
will. I will just, if you give me half a second, I'm going to pull up notes because I do have one. Okay. So this is an example of a personal example of mine. So recently I needed to change some personal information with a service provider. The process was rushed due to an admin error that this service provider had made. The time crunch and possible costs for not getting this change made in time were going to fall to me. Am I sharing a problem or a problem statement? Sorry.
Oh yeah, just do an IM statement if you've got one. Just one
Okay.
IM
So
statement.
here it is. I am a customer trying to change my personal health information, but administration, bureaucracy, and silliness is getting in my way. I'll use that word. I think that one's probably better. Resulting in me feeling frustrated, exhausted, overwhelmed. Like making me, and also possibly resulting in me having to bear costs for this mistake. And it makes me feel frustrated, like I don't matter. And really glad that I'm dealing with people over the phone instead of face to face in that situation.
That's
Thanks,
fun.
Lindsay.
We have one in the chat from Maggie. She says, I am working on a project with experts trying to change the conversation, but they are stuck to their education and problems. They are stuck to their education and problem solving. This resulted in feeling not belonging to the group and misunderstood.
Oh, yeah.
And
Yeah.
someone sharing their experience as a volleyball parent trying to book a hotel room for a tournament, but no one was answering the phone. So it resulted in a waste of time, making them feel frustrated, angry, and helpless and confused.
Oh, excellent. Good
Yeah.
one.
Yeah. And then I am a long-term care resident trying to have my needs met at a facility, but I do not have an assigned physician, resulting in me having to go to the hospital often, resulting in me feeling upset, in pain, neglected, and not cared for.
Oh
Wow,
my gosh.
there's tons. Home buyer experience. That's fantastic. Thanks for sharing all those.
Oh, excellent. Excellent. Thank you so much. And thanks, Lindsay. Great work. Yeah, see, it's so easy and it just brings everything together in a nice little package. And then we could do a root cause analysis on it, right? So excellent work, everybody. And what we did at 3S Health was that we applied it to our A3 thinking. So we use A3 plans at 3S Health for all of our strategic improvement initiatives and added the formula to the problem definition step. So those who may not be aware of what an A3 is, it's a simple one-page format problem-solving methodology that's based on lean principles, and it makes communicating it makes communicating ideas simple and eliminates the need for building time-consuming PowerPoints and presentations, right? So, so this method is simple to apply using pencil, paper, A3 format, obviously, and inputs from teams on the ground floor. That's how A3s work, input from teams. And we used the I am statement formula for 11 projects this year, and it really, really helped with conversations, which Jill will get into next. So thank you very much, everybody.
Thanks a lot, Janice. So yeah, we love the exercise Janice took us through this year. It really helped focus us, and like she said, it helps people understand the importance of the work they're doing. So I'm just very briefly going to talk about our Lives Impacted measure, and then so that we can get to hear our story from our linen partners. So 3S Health's been on this journey, and interestingly enough, that list of services that I showed you with the 6 boxes, we described ourselves that way for decades. And I think what's happened is we've evolved to a point where we can, and we used to even think that we were a support to the health system, but maybe not part of the health system. And now, because of our stronger patient connections, we're able to create a picture like this that says, here's how we are present at the bedside. We pay we pay and help schedule or provide the systems that help schedule the workers. We provide the systems that help them dictate their care records. We provide the linen and all of these things. So we're able to see ourselves as part of the health system and able to measure the impacts. So we have this target, like I mentioned, positively impacting 1.2 million lives by 2025. We've been doing this since 2017, and I'll just describe, like every measures are meant to guide behavior, and what gets measured gets improved. So it helps us, it helps our leadership focus our organization on how we're making that impact to patients. So we had to figure out how we would measure that. So the way we measure it is there's 3 components to the measure. One is we have to have demonstrated that we made a quality improvement for customers and patients. We have to figure out how many unique customers benefited from that, and we measure over a 1-year period. We've defined a quality improvement using the Institute of Medicine standard definitions. So if something we have worked on with a partner has made care safer, more timely, more effective, or any of these things, then we call it a quality improvement, but we have to have some evidence. And here's some examples just from past years, just so you can get an idea of the types of things. So all of these initiatives we worked on with our system partners, and when we report on these, we share the stories and we report on them as system improvements. But these are all things we've helped with in the past few years, and you'll see that not only, if you can imagine, in the old days, we would report that we had helped implement a new system, we had helped improve standards, we had introduced things. But now that we can calculate and describe how many people are impacting, the story gets stronger and it really helps us focus. So some really exciting improvements over the years that we've tracked. For those of you in Saskatchewan's healthcare system, we do have built our method using the standard provincial forms. We really love the improvement summary that we use at the end of every project. It really, in a very succinct way, describes what we did and what are the benefits. And there's spot for measure. We get, and we have folks quotes and sign-offs. What we added to the provincial suite of tools is just a sign-off on how did we calculate lives impacted. So what was the quality improvement? Who benefited? What was our evidence? And then we do the same thing with the number of lives. So whose lives are we counting and where are we going to get that data? So often it's a fairly simple process, but it's just putting that little bit of extra rigor so we can tell that part of the story. And the exciting news is we're actually meeting our 1.2 million lives this year, a little ahead of schedule. So really proud of that. And the benefits, you're going to hear from Lynn about the benefits, but I would just summarize that not only do we get to tell good news stories, I think sometimes when we don't strive to describe the improvement from the customer perspective, sometimes it's even hard to tell the story because we'll have described it in that businessy language and it's not as exciting. So we get to tell our story better. It helps all of our workers connect to why are we coming to work every day. It makes our planning stronger. We get better outcomes. And the other thing is it gives, if you engage a patient family partner at the beginning of the project and you say, you know, one of your roles with us is to help us make that connection and figure out how we're going to define that impact. It gives them a really important role and right at the beginning of the project. So I'm going to hand it off to our linen services team. We're going to describe a problem they helped solve and the awesome results they saw. Over to you, Jennifer.
Hey, thanks, Jill. I'm just going to steal the presenter mode from you. Give me 1 second. All right. So Jill and Janice did an excellent job of describing the tools that really help you get into your customer's shoes and understand what the problem is. And this is really the first step to creating a customer-centered business. Including your customer in decision-making processes will just take it to another level. So I'm going to tell you about my experience in my role and how we've had, good outcomes because of this. So as I mentioned before, I'm extremely excited about linen. I enjoy talking about improvements around linen and patients and families and even our frontline employees in the health authority. They offer our service line amazing opportunities by sharing with us what improvements we can make. And having their voice just really helps us make the changes that we need to make. So before I get into my story, I just want to acknowledge Lindsay and the role she plays as our patient family partner. So we really do our best to walk the talk when it comes to engagement and including the voice of our patient family partner in everything that we do. So that includes calling her into discussions, spending time training with her just to let her really observe our practices, see our processes. We listen to what she has to say, and it really just helps create a culture of inclusion. So I'm going to share one example from our team here. So we're going to talk today about MOPS, very exciting MOPS. Our linen services team does a great job of getting feedback from patients, from employees, from residents. We have a survey process that anyone in the healthcare field can access and let us know what's going well or what needs improvement. And it was through this process that we actually heard from some of the employees in environmental services that there was a lack of standardization with MOPS. I don't know, there's a lot of MOPS depicted in this picture. I don't think there was that many different types of MOPS, but there was sure quite a difference. Some people were using, the cotton style loop mops. Actually, most people were using the cotton loop mops that you can see in those green and red buckets. Some people had a microfiber product. Some had an old microfiber product that needed to be turned over. But for the most part, those cotton loop mops were the problem. And when you have a big province and one health authority, and you're working in one area and you see somebody in a different hospital using a different mop, you're going to ask, hey, do you think I can get that same mop too? So we decided to embark on an improvement process to explore the business case for changing these mops. So whenever we set out to do an improvement, we put it on our improvement plan. So here's just an example of what this one would have looked like. By adding it to the plan, it starts that conversation regarding whether or not it's a priority, who do we need to be engaging with, and what's our SMART target. And in this case, our SMART target is by December 1st, ensure KBRO, our linen provider, has enough microfiber mops to ensure all customers have access. So with Linen Services, we work very closely with our partners in environmental services, and we use this as a communication tool to go back to them and say, is this a priority for you as well? Should we be working on this together? Because we can't move improvements forward, without that collaboration. So there's lots of benefits from this work. And really what we learned from this is, in order to achieve our goal, we had a series of tasks we needed to do. We needed to look at our linen rates. Are those going to need to change in order to bring this product in? We need to test the product with different stakeholders and see, do we have the right mop? Is this the right next step? We probably need to, talk to our partners about the process for ordering. And we have a lot of, change management and communication that needs to do. So at a high level, it sounds like a business-centered problem with a business-centered resolution. But as we dig into it, we really look more at the customer-centered problem. So if you guys can see, the writing might be a little small, but this is the value stream map of mopping the floors. So when we set out to make this improvement, working with our partners, we thought, let's get out and really understand what the process is. And through that, we really helped identify what those customer-centered resolutions could be. So with a cotton loop mop, what the process would be, so put yourself, I guess, in the shoes of a housekeeper. You're working at a big hospital, the General Hospital or City Hospital in Saskatoon, and you have all those floors to clean. And you need to start by filling up a big bucket with water in solution, and then you would roll it to the room that you're going to start cleaning. You would attach your mop head to that frame, and then you'd clean the floor, and you would clean three patient rooms, and then you'd have to roll that bucket back to a soiled service room, dump the water and the solution out, change the mop head, go back to the rooms and continue cleaning. So you would repeat that process for every 3 rooms that are cleaned. So you can imagine all those extra steps happening along the way. When we looked at this process, we really started to see some of those additional improvements that come out of this. Yes, you're reducing steps and you're you're looking at standardization, but you're also looking at the heaviness of the mops and those buckets. And when you pour the buckets out, they're splash pack. You're changing a mop head every 3 rooms. So, every room's not getting its own mop. You worry about cross-contamination, those sort of things. So when we started to go through the process of understanding the customer-centered problem, it became clear that this change needed to happen, not because it was the right thing to do, for business, create standardization, but it was, most importantly, we had to do it for our customers and patients. So by implementing the new microfiber mop, the value stream that we saw on the previous slide would really just change for the better. So we have some pictures here that show sort of, this is the current state on the left before the improvement, and then the future state is the picture of the microfiber mop. And if you just look at the picture, you can see differences. Look at the bulk around the mop on the left. You can tell when saturated with water, that thing's going to be heavy. And then look at the microfiber mop and how slim it is. That red bucket in the left-hand corner, that's the bucket that we're talking about, rolling back and forth, dumping, refilling. Imagine how heavy that is to have to tip it over and roll it out and dump it out. So I went through this problem thinking about Janice's 5 questions. And I just see Greg's comment. Greg is one of our key partners who actually helped roll this out. So glad Greg was able to be on the call. But this, from a patient problem, a patient perspective, using the IM, it would sound something like this. So I am a patient of a Saskatchewan hospital trying to receive care for my illness, but I'm afraid of picking up another illness from germs and other patients when in the hospital, resulting in becoming more ill, which makes me feel discouraged and nervous about even going to the hospital in the first place. And just think about the last few years in our hospitals. That's a real fear that people have. We don't want to go into a hospital and get sicker. Now look at it from the employee perspective. So I am a housekeeper in a hospital, and I'm trying to use these cotton loop mops to disinfect and clean hospital floors. But these mops are heavy and difficult to use, and they often just move the bacteria and dirt around rather than eliminating it, resulting in germs being left on the floor, cross-contamination, and lost time due to shoulder and back injuries, which makes me feel tired, irritated, maybe skeptical. Most importantly, it makes me feel sore and injured. So in our post-improvement, this is the mop and hardware system that's used for cleaning floors. So you can see it's a much smaller system. So I'll just verbally walk you through what the new value stream would be. So the night before a shift, a housekeeper would fill that bucket, the yellow bucket there, with the water in the solution, and they would add the mops to it as well. And you could stack quite a few mops in there, 30 to 50 mops. I'm not sure of the exact number. And you would stack them, the Velcro side of the mop up, so that when you put your mop in, it just easily attaches to the frame. So that bucket would then go on a housekeeping cart. An environmental service worker would then roll that cart to where they're going to start cleaning. They would open the lid, stick the end of the mop handle in, attach it to a frame, and clean a room. Now, when they were done cleaning the room and they were going into the patient bathroom, they could take the mop off, stick it onto another mop, and clean the bathroom. And you would do that between every single patient room. So you've eliminated walking back and forth to dump and refill your bucket. You've got all your mops with you and all the solution you need with you. Not only are you no longer switching out mops every 3 rooms, you're switching them out every room and even between the room and the bathroom as well. No more splashback, no more heavy mop buckets. And it's standard just across the board. But wait, there's more. We also found through this process, we're reducing water and chemical use. Cotton loop mops use about 90% more water and chemicals than microfiber does. So these quality improvements really add up, and they can create a positive environmental impact. But the best part, we improve the cleanliness of our healthcare facilities for the people of our province and anyone who accesses them. So a little linen learning moment. Microfiber is made up of a fine blend of synthetic materials, and it allows those materials allow them to trap and hold bacteria and dust and dirt within those fibers. Opposed to cotton really just pushes the dirt and debris around. It doesn't pick it up. Microfiber mops remove 95% more microbes compared to a cotton loop mop. So it's just providing a really clean facility. So we're making an improvement that impacts the employee. We're making an impact that improves the patient. So at the end of the day, when we sat down to actually measure the impacts, we thought about it from those 2 perspectives. We've created safer care, right? We've impacted 106,514 acute care patients. So we did this measure by looking at the acute patients in 1 year that would visit a facility who had access to these mops. Now we have to note there were a few facilities that were using microfiber mops before. We didn't include those in this count. They were a small number of facilities. So we left those out of this count, but we look at improving the way that we clean the rooms, that impacts the end user. And then we improved the safety to 2,617 healthcare providers by reducing the risk of shoulder injury. Okay, I see your comment in the chat there, so I'll buzz this along. Really quick, The whole point of doing this work is to create an improvement for our partners, for our customers, for our patients, but we have to stop and celebrate too. And so this is just an example of one of the stories that was written about this. We write these stories not as 3S Health achievements, but they're health system improvements. We couldn't do them without partnering with our partners at the SHA. So we write these stories from that perspective and we share them across the health system. I'm going to pass it over to Lindsay now for her piece, and then we'll be able to close off and just ask for questions.
Awesome. Okay, well, I will try to be fairly tight here so that we can get some time for questions. But I just wanted to share, some of my experience as a patient family partner with 3S Health. So, and some notes, for anybody who's working on this or doing this. Setting up an engagement program is work. It's going to take time. It's going to take money and commitment to support that engagement program. But I will promise you, your patients, your clients, and your staff, we want to work with you to make things better. As a leader in the organization, it's your job to make sure that that door is open and the time, energy, and emotional labor that your customers are offering is honored with these resources. And that is what 3S Health does really well. I have sat on many, many committees in my life, and I can tell you which ones were checking a box and which ones actually were committed to growth through engagement. I think that the focus on lives impacted is a large part of the reason that the PFP program at 3S Health has been so successful. So lives impacted is a metric that matters, and arguably, in my opinion, the metric probably that could matter the most. Because it ensures that the work that's done in healthcare is rooted in patient experience and outcomes. Healthcare is personal. It's personal for patients, for the family members, and for those who are delivering the care. So lives impacted makes sure that this is always a part of that decision-making equation. So with the microfiber mop project, as Jen said, it was started with the eye on how do we make the lives of patients and providers and the people who are working that front line better. This change was implemented with that as the goal. There was cost savings and reduction of waste that came along with it, but the project was driven by that goal of positively impacting lives. This was also one of the first projects that I was involved with at 3S Health. I came in more towards the end of the rollout, but I got to see the wrap up of the project and how much time and energy was put into considering the lives impacted. And it showed me that this team really wanted to walk the walk. So I was excited to keep working with them. I remember being in the hospital with my dad and watching that mop go from room to room, and then seeing this new mop and just being really excited because I knew what difference that was going to make every day. So over the past 2 years, our team, we've grown together, and this has allowed me to take a larger role in projects. Recently, I was asked to be part of the co-lead to improve the survey that Jen was talking about. So at the very beginning of this process, I was able to share my experience as a family member of a patient in long-term care, as a patient myself, and that life experience of being asked to fill out just another survey, or being asked to fill anything out and feeling overwhelmed and exhausted and maybe not safe sharing that information. So I brought that up, and we were able to take that and actually change the lens of the project to how does 3S Health engage with residents, families, and clinical staff so they are able to provide their experience with linen. Now we had a customer-focused problem statement that we could dig into. I also, sorry, everybody's going. Sorry. I also used my experience as a family member to really champion a piece that came up during our research phase. It was around residents' feeling of safety in sharing feedback during long-term care. And I don't want to say that I think this may have been discarded had I not been there, but it came up once. And so I think during the evaluation process, it might not have gotten quite the amount of weight that it that it deserved. So I put my thumb on that scale a little bit, and I made sure that that came through in every bit of the conversation and was really considered in the idea generation and the solution implementation phase of the project. So what I wanted to do with those examples is just illustrate the value of including lives impacted and the patient voice and the frontline staff voice in all stages of the project. It can get easy to get lost in numbers and abstract ideas, but at the end of the day, the patient experience, as well as that impact on frontline providers, is what needs to be top of mind. And when you're willing to put the work in and create the opportunity for engagement, it will pay off.
Thanks, Lindsay. Sorry, I just, in the interest of time, and I didn't want to cut you off because I felt this is the important part here, hearing directly from the patient, family partner in terms of what impact it's had and your role. But we are unfortunately out of time, and it was well worth going a little bit over, I think, to hear all the fantastic information that's been shared today. I do want to encourage everyone to reach out. We did share in the chat how to contact, and here as well on the slide directly to 3sHealth to learn more. And I want to thank all the presenters and for you, the participants, for joining us today. I just want to add, there was a flurry of information coming at me, but I would challenge our listeners, particularly with the I am statement. That seems like something that we could kind of put into practice right away in some of our work. So a challenge and out to you by next week, maybe seeing if that's something you can build it to some of your problem statement development in your work. Just quickly, I wanted to flag that, if you want the coveted QI socks, there's a way to get them, and that's to become a QI Power Hour speaker. So just want you to think about joining our website or going to our website to learn more if you have a hot topic you'd like to share. We will be sending out evaluation surveys, so don't be alarmed if that pops up. We do encourage you to complete that. And just to say that next up on our series is Dr. Ginger Ruddy joining us on June 16th to talk about the patient's medical home. So thanks all of you for joining. We're about 2 minutes over, but thank you again for making the time, and thank you again to our panelists. Bye, everyone.